Hello friends, it has been a long time since I made a video on some topic NEET PG. Now today, I think it is almost a 1 week gap. I'm making this video for you. Now today I'm going to deal with a very important topic of cardiology, very concept building MCQs of cardiology, which will be an integrated session of pharmacology and medicine, and we'll deal with arrhythmias in the setting of heart failure and acute coronary syndromes. Now coming to the first question of today's session. A 70-year-old patient with chronic heart disease having an arrhythmia. ECG diagnosis is PSVT. Patient is stable. Adenosine and vagal maneuvers are tried, but the patient doesn't respond. Hence, IV procainamide is being considered. Patient is already on digoxin and hydrochlorothiazide and potassium supplements. Which of the following statements is correct? Now, see the statements one by one. A possible drug interaction with digoxin suggests that digoxin levels should be obtained before and after starting procainamide. Hyperkalemia should be avoided to reduce procainamide toxicity. C. Procainamide reduces the action potential duration, and D. Procainamide decreases the effective refractory period. Now, first statement. Now, the first statement cannot be correct because procainamide doesn't have any significant interaction with digoxin, so it is ruled out. Now, the second statement is the hyperkalemia should be avoided to reduce procainamide toxicity. It can be correct because procainamide toxicity is increased if the patient is having hyperkalemia, and here in the this setting, potassium supplements are being given to the patient, so this can be a correct statement. Now, procainamide reduces action potential duration. Now you know that all the class one agents, they decrease the slope of the uh, action potential. So they increase the duration of the action potential. So this statement cannot be correct. And the last is the procainamide decreases effective refractive period. It cannot be correct because all the class one agents, they increase the effective refractive period. So the answer here should be answer number B. Now coming to a second question. A 60-year-old man is admitted to an emergency department with the chest pain and fast, irregular heart rhythm. ECG was done, which shows inferior wall MI and ventricular tachycardia. What is the drug of choice for this patient? Now, as our topic for today is the arrhythmia and the setting of the acute coronary syndromes and heart failure. So here the patient is having acute coronary syndrome. Now, in the acute coronary syndromes, if the patient is having inferior wall MI, and I have previously also told in the previously I have also dealt in the previous video that if both lidocaine and amiodarone are given the choices, then amiodarone will be the best option amongst the two. Procainamide and adenosine cannot be there had because adenosine is given in PSVTs and supraventricular tachycardias. Procainamide also likely in those settings. But here the answer is between lidocaine and amiodarone. If the amiodarone is given, then amiodarone will be the best choice. And if the amiodarone is not given, then lidocaine will be the choice. So now coming to a third question for today, a 55-year-old patient with acute anterior wall MI in ICU presents with supraventricular arrhythmia. Other findings include bilateral pedal edema, orthopnea, and raised JVP. 2D echo was done and ejection fraction was 30%. What is the next step in this case? Now, what is the next step? So here you can see that patient is in failure, obviously, and why he is in heart failure? Probably, most probably due to this and anterior wall MI. So as you know that in the setting of the heart failure, digoxin is the first drug of choice which we will consider. So here the next step is asked. So digoxin is the next step. Although sacubitril valsartan is also used in heart failure, but it cannot be the answer. Next step should be digoxin. So here digoxin is the answer. Metoprolol, verapamil, they are considered, but in this setting, the answer is digoxin. Now it is important to note here that if the question has is changed slightly and the acute coronary syndrome setting is not given, only congestive heart failure is given, then the answer would have been different. Then the answer would have been either a diuretic or a beta blocker. But in this setting in which the acute coronary syndrome is given, and in this setting if the supraventricular arrhythmia is happening, then the answer here should be in the presence of heart failure, the answer should be digoxin. If the heart failure is not given, then the answer should be either the calcium channel blocker, that is verapamil diltiazem, or metoprolol. That will be the best answer. So, or the you must see all the permutations and combinations. According to that, you must answer the question. So that is very important to see which permutation combination is given the question. And here, in the presence of heart failure and the setting of acute coronary syndrome and supraventricular arrhythmia, the best answer is digoxin. Now, coming to a fourth question. A 16-year-old girl has paroxysmal attacks of rapid heart rate and palpitations and shortness of breath. These attacks often terminate spontaneously but often require visit to emergency department of the local hospital. A ECG during this period reveals an AV nodal tachycardia. The antiarrhythmic of choice in most cases of acute AV nodal tachycardia is. Now you see the calcium channel blockers can terminate these attacks of AV nodal or the supraventricular tachycardias. But as you know, we have dealt in the previous lectures also, adenosine is now preferred drug because it is less toxic. And so here the answer is the answer number A, which is adenosine. Now coming to the fifth question. A 65-year-old man comes to emergency department with severe chest pain. ECG reveals VT, ventricular tachycardia with occasional sinus beats and ST segment changes sensitive of ischemia. He is immediately admitted to cardiac ICU. His arrhythmia should be immediately treated with. Now, you see that the topic as we are dealing is the arrhythmias in the settings of acute coronary syndromes and the heart failure. So here again the ischemic changes are there, and which drug will you prefer in this case? Now, as I have told often, only two drugs, amiodarone and lidocaine, are to be considered in the setting of VT uh, after an acute coronary syndrome. So here amiodarone is not in the choice, so you have to search for lidocaine. Lidocaine is given. Lidocaine is the best answer here, and previously I have also dealt that lidocaine affects most in the ischemic tissue, and here lidocaine is the uh, better choice. Digoxin, adenosine, verapamil are out of the context here, so lidocaine is the answer of choice here. Now coming to our sixth question for today. A 40-year-old woman with poorly controlled thyrotoxicosis has recurrent episodes of tachycardia with severe shortness of breath. When she is admitted to the emergency department, which one of the following drugs is most suitable? Now, this question has been asked recently in an entrance examination. You all must be knowing, and but the frame of the question was different, but mainly the question was of similar type. So now here you see the patient is having thyrotoxicosis, and the setting of thyrotoxicosis, she's having tachycardia. Now, thyrotoxicosis, as you know, is a frequent cause of atrial fibrillation. So now, in this setting, what is going to be the answer here? Now, the most suitable. As you know, the amiodarone is also used in atrial fibrillation, and the verapamil, diazepam, all these are used. But the next step, first we have to control the rate, and the rate has to be controlled by the beta blockers. And here the esmolol is given in the choice, and so the esmolol is the next choice. Esmolol is the answer of choice in this question. And you must be recalling that in the question which was asked in the entrance examination, the antithyroid drugs was also in the choice. So if the definitive treatment of this case is asked, then the antithyroid drug is the answer. But the most suitable among these choices, so esmolol is the answer of choice here. Now coming to the last question for today's session, the patient of heart failure on digitalis presents with the nausea and vomiting and atrial fibrillation. Serum potassium is 2.5 millimole per liter. What should be the initial step of the management? Now here you can see that amiodarone, cardioversion, metoprolol, potassium supplements, they are given. Now you know that the initial step should be we must check the electrolytes, and hypokalemia favors the digitalis toxicity. So here the patient is having, clearly it is given 2.5 millimole per liter. So the initial step should here be the answer should be the potassium supplements, because sometimes they only correct the this arrhythmia. Now if that potassium supplement is not in the answer, then we'll go for the other choices which are given. But here clearly the answer is potassium supplements. Now an important word for the digitalis toxicity. Digitalis toxicity is a very important upcoming topic, and which is frequently asked in your entrance examination. And you know, if the in acute intoxication of digitalis, the sometimes the hyperkalemia is there, and you must check the potassium, and you must not give potassium directly, considering that the hypokalemia will be present. So this is very important to check. Potassium levels should be checked, and then only the potassium supplements should be given. Now, some the questions about the Fab antibodies are also asked. So, if the this arrhythmia is not controlled by these all these measures, like the first you give the potassium supplements and then the other drugs, the beta blockers and the procainamide, etc. So then comes the role of the this anti-dioxin antibodies, and it is often a frequently asked topic in the examinations. So one very important fact about the digitalis is a drug which can cause any type of arrhythmia from the atria to the ventricle to the Purkinje fibers. So it can cause atrial fibrillation, atrial flutter. It can cause AV nodal tachycardia. It can cause ventricular tachycardia. It can cause ventricular fibrillation, premature ventricular beats, ventricular bigeminy. So any type of arrhythmia you have in your mind, digitalis can cause that arrhythmia. So I hope you understood today's lecture. Please do like and subscribe our channel.